tell me a little bit about the conditions that qualify you for medical marijuana.
Fibromyalgia is my qualifying medical condition.
All right.
In addition to fibromyalgia, I have osteoarthritis, I have anxiety, and depression as well. Before I was able to get the medical marijuana, it was a struggle for me to be able to work because my osteoarthritis is bone on bone. So basically I hobble around. I was pretty cranky a lot of times because of the pain, because I can't tolerate the pain medications. So I wasn't taking anything. I can't tolerate it. So I was just living in misery.
And how about since you started using medical marijuana?
Since I started using medical marijuana, the last time I took an alprazolam, which is Xanax, was November 19th, which it was when I was able to make my first legal purchase. So since November 19th, I have not taken any Xanax at all. And I would normally take at least 1 milligram a day. So from that point on to now, I've not taken any Xanax, which to me is a big victory because that stuff makes you feel groggy. It doesn't make you think clear. And I don't feel like that with cannabis.
So you notice a big difference since using medical marijuana, or is it a gradual change?
No, big difference. I was able to measure my knee, the circumference of my knee, because I have a lot of inflammation and a lot of pain in my knees. So measured my knees, and there was a 4-inch decrease in the circumference of my leg when I was able to start the medical cannabis. So my knees would be all gnarly and swelled up and miserable and painful, and the cannabis gives me relief because, like I said, I couldn't take any of the Vicodin and all the other things that the doctors wanted me to take for my pain. It made me feel wacky and mixed up and sick at my stomach, and I just didn't like that feeling. The cannabis has just helped so much.
And any side effects from that?
Not a side effect. Nothing. The chocolates make you think clearly. They don't have a side effect where you're feeling hungover the next day, and they address my pain.
And what are your thoughts on the Illinois medical cannabis program?
I feel like it's benefiting so many people. I have been at the end of people's life. I'm a hospice volunteer, and I'm one of the ones that sees human suffering at its worst. When people are at their end of their life and they're actually suffering and they can't find any relief from their pain, they're taking the Vicodin, they're taking the medications that address the pain, but it doesn't work. It might make their stomach all grumbled up and they might have constipation where their bowels can't move. I just lost my dad in July, and he had cancer. And his cancer, he was reluctant to try the cannabis because of the stereotypes and everything, and I had admitted to him that I was going to be getting the cannabis and that I got a medical card. I was going to be getting the cannabis and I was medically approved. And then that's when he made a confession to me that when my mother had gotten sick with cancer when I was only 15, she was able to have good days when she used marijuana. So, like true confessions, Dad's deathbed, and he's telling me that the thing that helped my mom the most was the cannabis. But yet he was afraid to try it, even there at the end, because of the stigma.
Okay.
And it shouldn't be that way.
And how do you feel about the stigma associated with cannabis?
I feel like it's unfair. I feel like I'm hiding in the shadows. I feel like if we were talking about medication, I wouldn't be hiding in the shadows. Like prescription medication. This to me is medicine. I don't treat it as anything other than medication to me. But the stigma is Cheech and Chong. Sit around, get high, get the munchies, and it's all about the high. To me, it's not that. It's all about the pain relief. It's all about being able to think clearly. It's about being able to function in life. It's about having a quality of life. Being able to bend down and tie your shoes is a big victory when you have to have someone tie them for you because your legs don't work. And that's the important thing, feeling like you can live again.
Because that's what this is about, improving quality of life.
Exactly.